Efforts to get booster shots in the arms of eligible Vermonters is off to a strong start. But Governor Phil Scott and his administration are also focused on high case numbers in areas of the state where vaccination rates have stalled. Local 22's Devin Bates joins us now live in the newsroom with more on this tonight. Hi, Devin.
That's right, Lauren. The big case counts this week came from Vermont's most populous county in Chittenden, as well as Orleans County, which has the second lowest vaccination rate in Vermont. Now, as state leaders try and get the word out about boosters, they're also taking active steps to push vaccinations in general for areas that have been hard to reach for some time. Right now, Orleans County has the highest positivity rate in Vermont.
1,531 cases per 100,000. That is almost 3 times over the statewide average.
State leaders have been in touch with local lawmakers as they try to bring the county's vaccination rate up, which currently sits 8% below the statewide average.
I want to be clear, this is not intended as finger pointing at any one part of our state. Rather, it's a reflection of the data that we see roll in nightly.
I'm 100% unconvinced that the people in Orleans County who have chosen to not be vaccinated will never be vaccinated.
Meanwhile, in these early days of Vermont's booster expansion, over 3,400 people have made appointments on the state website, while many are opting to get one through a pharmacy or their primary care provider. Vermont ranks second in the nation when it comes to people 65 and older getting their boosters.
They're the ones we're most concerned about. Far less concerned about a 25-year-old who's completely healthy and may be ready for their booster and not so sure about it, what have you. They're going to do fine, but I'm much more worried about the people who are much more higher risk and vulnerable.
And while some Vermont counties haven't been able to cut down on cases, the state as a whole is starting to see a downturn. Case counts dropped 15% this past week, but in that same span, hospitalization rates among the unvaccinated continued to go up. As such, Governor Phil Scott responded to new calls for a state of emergency, this time from 9 state lawmakers and half a dozen medical professionals.
There's a time and a place for a state of emergency, and I can assure you this isn't it. We'll get through this, and I believe that we're all working to overcome this, and I'm hopeful with the numbers we're seeing.
Now, that group inside the State House voiced particular concern about outbreaks in schools. Today we learned of at least 3 outbreaks that required outside help from state officials for response testing. One of those in the Canaan School District, one in Orleans Southwest Supervisory Union, and one within Maple Run School District in St. Albans. Live in the newsroom, Devin Bates, Local 22 News.
Devin, thank you. Earlier today, Governor Phil Scott and other state leaders rolled up their sleeves and invited us along as they got their flu shots. The Vermont Health Department says it's important for everyone to get their flu shot this year to prevent that potential of a twindemic we've heard about. It is safe to get a flu shot the same day as you get a COVID booster, we're told. By the way, Governor Scott said he is hoping to get his COVID booster this week. He received the J&J 1 dose in early April. He is still trying to decide which brand to get.
The good news is all 3 are effective. And so you can't go wrong, but I'm always looking to get the edge in any way I can. So I'm going to do my homework and determine what is the best for me.
Last week, the CDC approved